Well, I've always had an interest in missions and giving back. For me, there's not many people who go on missions that can do what I do, and so I wanted to be able to offer the level of subspecialty care that we have in the United States into an area where they don't receive that. Those people also are non-functional a lot of times. I mean, sometimes that's their better eye that we're talking about. And so we take somebody who really can't really provide for his family because he can't see, and you make him to someone, and they may not get 20/20 vision afterwards, but they get functional vision so that they can actually work and they can provide for their family. I mean, that's a pretty life-changing thing.
Teaching is sort of a passion of mine. As my private practice got busier, I had to find a different way to kind of chase my passion. The Lions Eye Institute asked me if I would mind being one of their test sites for the new pre-prepared tissue. Some of that research had been done by some of my prior fellows, and we had good results, and said absolutely, I'd love to try that, because quite frankly, that's my least favorite part of the surgery, is preparing the tissue. So they asked me to do a few of these cases. I had good results and never went back to preparing the tissue on my own. I was able to partner with the Lions Eye Institute for Transplant and Research to take these techniques internationally.
This last time I went, I had this one guy, and he just had the worst looking cornea I've ever seen. I just didn't even know what to do with it. And he had this big ectasia or whatever, and his eye was all bulging out, and it just looked terrible. And I basically did a huge graft and reconstructed his eye, and I'm thinking, this thing's never gonna work. I saw him back the next year. He looked perfect. It was amazing. So, I mean, it really makes you feel good, and it makes you feel like you really are making a difference in these people's lives.
The first country that we've gone to is Mexico. And basically what I'm teaching is both DSEC, which is the older generation of these transplants, and DMEC, depending on the skill level of the surgeons at the facilities that I'm teaching. The first trip was to Mexico City. We did one hospital we taught DSEC surgery to. Those surgeons had done only, between 5 surgeons, they had done 3 DSEC cases. This is a technique that's been around since 2006. And at that particular facility, that's all they've been able to do. Part of it because of the skills, part of it because of the expense of the technique.
I've actually recruited some other cornea surgeons to go down there. I'm still trying to do that, just because as many, I do 25 corneal transplants down there, there's 50 patients that are waiting that I couldn't get to. It's just, so there's lots of need down there. And Honduras doesn't have an eye bank, so they don't have corneal tissue. You can't get it in Honduras, so we have to bring it down.
The foundation has been very, very good about financing the trip, as well as making the contacts that I need in order to get in there to do the training. If I was doing this completely on my own, I wouldn't know who to call in Mexico City to ask if they needed training or if they were interested. So that all came through the Lions Eye Institute. They have the connections through their network of surgeons who use their tissue. And so they saw the need. They saw me as someone who at least enjoys teaching and thought that maybe it would be something I was interested in. They asked, I went, and it was fantastic.
I'm very blessed that the eye bank is able to give me this tissue, because I know it costs them money to do that. And so for them to be able to give that to me for free, to bring to Honduras where they can't afford it, I mean, it's just, that's awesome.
When you see some individual who has a name and a face that would not have been able to get a cornea transplant were it not for the foundation. Yes, the emotions of that one story is great, but you're training one surgeon who maybe does 100 of these transplants over the next year or two. That's a great, great increase in the breadth of the reach and the number of people that you can actually help. And so rather than just taking that one cornea transplant to that one person in Mexico or in Vietnam or in any of the new countries that we're moving to with the Lions Eye Institute, to take that ability to do those surgeries to the surgeons, I think just pays a much higher reward at the end of the day.
For them to be able to continue to do that, the foundation needs the support they need financial support. And so anyone who thinks this is a great thing like I do, I think that would be a great opportunity to make your money do something that's very worthwhile.
O'zimni Amerikadan kelgan shohlardan qo'yib 2016-yil 14-dekabr kuni operatsiya qilishdi. Ko'zim hozir ancha yaxshi ko'ryapman, ishlayapman.